He spent only a few years in Alberta, but former AHS president and CEO Stephen Duckett left an impression. An internationally respected healthcare economist, Duckett was recruited from Australia in 2009 and tasked with cutting $1 billion from the budget and overseeing the amalgamation of Alberta's 9 health regions.
Isn't it ridiculous that the media are not prepared to go to the media scrum? And I'm eating my cookie.
There was fallout from his reforms, and about 2 years later, he was fired, in part due to his handling of it. Now a health professor in Melbourne, Alberta is no longer in his purview. However,
if I were living in Alberta, I'd say this is, a really scary sort of policy initiative.
Duckett is referring to the UCP government's new plan to increase privatization by allowing surgeons to complete both public and privately funded elective surgeries. In a social media video, the Premier explains why she believes this will improve wait times for all.
They will be able to have their surgery performed in the off hours and come off the public wait list at no extra cost to taxpayers. That means everyone on the public wait list moves up in the queue so that they also get their publicly insured surgery done quicker than they otherwise would.
Danielle Smith named Australia as one of the countries where a hybrid model works. Duckett says what the Premier describes isn't what happens.
The evidence from Australia is that if you start to introduce private care, you end up with longer waiting lists in the public sector and so on. So I think it's something you have to tread very warily.
In Australia, Medicare covers essential health care for all citizens and permanent residents. There is also a significant private sector. According to the Australian government, more than half of Australians access private doctors and hospitals, mainly paid for by private insurance.
In a sense, the hospital system ends up as a two-speed system. That is, if you've got hip pain or knee pain and you need to have a hip replacement or a knee replacement, the waiting time for that is much shorter if you go privately than if you go on the public hospital system.
Duckett says having two different systems also increases admin costs. He credits other parts of the Australian system for shorter wait times and lower healthcare costs.
I think there are multiple differences between the two countries, and just assuming that I've chosen this difference and that therefore must explain everything, I think it's a bit naive.
One of those differences is the number of doctors. Data from an international info hub shows in 2023, Canada had 2.72 practicing physicians per 1,000 people. Australia had 4.2. European countries led the pack, with Austria taking top spot at 5.51 doctors per 1,000 people.
So if some are treating private patients, there's not as much opportunity for the public system to suffer as perhaps there is here.
One emergency physician says a shortage of certain healthcare workers is already limiting important surgeries in Alberta.
We have empty operating rooms because we do not have enough anesthesiologists and nurses already to staff those. And I'm not talking empty at nighttime. I'm talking always empty.
Alberta's health ministers say one of the reasons they're trying this new model is to attract staff.
I think this is a tool that will help us retain physicians and other healthcare professionals that are frankly going to other jurisdictions, and it will retain that activity in the Alberta economy.
Legislators vow safeguards will be put in place to ensure the public system doesn't suffer. They say they're not putting those specifics into legislation so they can change things quickly if issues arise.
Or that we have to make some changes because all of a sudden we do need to shift. We need to be